A picture of panic from above as Canberrans once again turn out in droves to get tested, and case numbers climb quicker than ever before.
We've had 22 new cases overnight. This is bringing the total number of cases in the ACT to 67.
All 22 new cases can be linked. Of the 67 total cases, only 4 remain under investigation, including the first case reported almost a week ago. Transmission of the virus has now been recorded at 7 locations across Canberra. 15 cases are now linked to Lyneham High. 13 can be connected to the Fiction nightclub. The Lennox Jaguar cluster now sits at 6 cases. 5 cases can be linked to the Belconnen basketball stadium, and another 5 are connected to the Gold Creek School. The Downer Community Centre cluster sits at 3, and 2 cases can be traced back to the Assembly Bar.
There are no further cases at the Greenway Views Village. All residents and staff that are located on site have been tested, and all those results have come back negative.
The number of close contacts has jumped to 10,500. The list of exposure sites has now grown to more than 190. Gigi's Flowers, a social enterprise for Canberrans with an intellectual disability, has landed on the list.
We did everything by the book. We have been so cautious, and to still be in this position is really heartbreaking and heart-wrenching.
An occupational therapist who visited the business has since tested positive to COVID-19. Thankfully,
we have all had multiple tests and we've all tested negative.
3 more schools are now exposure sites. The entire Harrison school community is isolating after 2 positive COVID-19 cases visited the grounds while infectious.
It's quite scary. To think that this virus has come so close to home into schools. And you think about it, schools is where you have hundreds upon hundreds of kids at the one time close together.
All up, 7 Canberra schools have been caught up in this outbreak, and it shows in the numbers.
The median age is 19.5 years, which gives us an indication that there are many, half of the number of cases that we have is under 20 years of age, but the age range is between 3 years and 62 years.
Senator Katie Gallagher's 14-year-old daughter is one of those positive cases.
My little girl's, lying in bed on her own with terrible symptoms, and I can't do anything about it, and my son's in the next room waiting to catch it. And that, I know, as a parent, it's really difficult.
She says Australia's vaccine rollout has failed young people.
All this stuff, it's not a race, and, we'll get there when we can. It's not been enough to protect Evie. And Evie's just like thousands of other young Australians. And as a parent, I just feel like we've been let down, and it's very stressful. If
we're going to be in this together as a community, then children need to be included in that.
The National Medical Regulator has approved Pfizer for 12 to 15-year-olds. It's now up to the country's expert panel on immunisations to green light the expansion of the rollout.
It's not too far away, is my understanding, but equally, we're talking about the vaccination of our kids, and I want to be very sure about the medical advice we're getting about that.
Even after it gets the tick of approval, the problem may still be supply.
I can't promise vaccines for people when we don't have the vaccines, but as soon as we do, we will.
Demand for testing has shown little sign of slowing down.
In the last 24 hours, 8,417 tests were conducted in the ACT.
The Health Minister insists a 24-hour operation is not the answer, especially during winter.
And the more people we have on overnight 24 hours, the fewer people we're going to be able to have on during the day.
The system is under strain and the workforce significantly depleted, with 400 health workers in quarantine.
we are continuing to have a look at what non-urgent elective activity, both outpatients and potentially surgery, we may have to scale back in order to be able to do the frontline public health response.
A job that's growing bigger by the day. Rosie King, ABC News, Canberra.